My name's Dr Cooke. I'm a consultant in occupational medicine. So I qualified in medicine initially about 49 years ago, and very soon went into occupational medicine with what was then the Coal Board, and progressed through several other industries, ultimately becoming an independent consultant, specialist, and developed an interest in vibration-related disease when I became Chief Medical Officer of the GKN group of companies, engineering group. There was greater recognition through a workshop that was held in Stockholm, and that's really when the term hand-arm vibration syndrome came into general use. And that defines three types of injury. So injury to the blood vessels, injury to the fine nerves, in the fingers particularly, and then what we term the musculoskeletal effect, so cramps, loss of grip strength and so forth. The key thing about hand-arm vibration syndrome is that you've got an external source of energy. So you've got the vibrational energy that's being absorbed into the body, and it causes damage to body tissue. The musculoskeletal problems and repetitive strain injuries, there tends not to be an external source of energy. It tends to be repetitive, frequent movements of the body, so it's the overuse of the body, the muscles, that often leads to those injuries. The immediate impact is obviously that they have potential to lose a highly trained employee from a task that they've done for many years, and so they not only have potentially to look for other alternative work for that individual, but have to train somebody to replace them. Then there's the cost of claims, where a company is alleged to have exposed someone to negligent levels of exposure. The only real way of protecting people from developing hand-arm vibration syndrome or the other conditions is to reduce their exposure to vibration. As I say, it's based on the amount of energy that's transmitted into the individual's hands, and you have to reduce that. The way in which companies have tried to avoid problems is, first of all, to avoid exposure, which is the ideal, and to reduce the exposure at source is obviously the best, so either doing the job a different way, not exposing an individual at all, or using different tools. Monitoring of vibration exposure is absolutely fundamental to the whole process of prevention. The likelihood of developing vibration-related disease is related to vibration dose, probably over a lifetime. And unless we monitor that exposure, we have no idea of the dose that's actually being administered to the hands and therefore causing the damage. So originally we looked at tool use, measured the vibration emissions of the tools, looked at the time they were exposed using a stopwatch or just asking the individuals. But that's fraught with difficulties because people don't remember, with the best will in the world, how long they've used the tools for. And so actually to be able to monitor continuously the duration of exposure and combine that with the dose really gives us a very powerful tool to say what the likely risk is of an individual developing vibration-related disease. We're certainly going to see reductions in exposure further, and we glibly use the term to reduce exposure so far as is reasonably practicable. And I think as companies take that on board, rather than trying to use a definitive level as being safe, that'll increase the benefit, it'll reduce exposure. The fact we're picking people up at an earlier stage because of improved health surveillance has to be good. It's unfortunate that we are still picking people up because it means we're still causing the disease. But by picking them up at an early stage, we can prevent that horrific impact on their daily lives by allowing it to progress to a later stage. So there's enormous potential benefit, but we equally have a long way to go to achieve that, I think.